Okay, well, thank you for coming and participating here with our Navigating Medicare Benefits online seminar here in Zoom. This program will also be recorded and will be available to some people that requested the recording, as well as other people that may want to request it in the future. We can send them to you by email as well. So anyway, thank you very much for coming. My name is Manuel Roberto, and just an introduction to ourselves, myself, being an insurance agent for many years in Hawaii as well as here in Florida. And I have 3 children. I went to UC Berkeley, as you can see my t-shirt over there, UC Berkeley, and graduated a few years ago. And I also play the flute. I'm a musician, and I am married to this beautiful, wonderful person, Bernice. Bernice, would you like to introduce yourself?
Hello, my name is Bernice Roberto, and Manuel and I have been together for coming up this year for 50 years. So that's really, a lot of people consider that a real accomplishment, and I do too, actually. So we have 3 children, like Manuel mentioned. They're all grown up, and I'm also a UC Berkeley alumni. So we had our early years there, and I'm just really excited to work with Medicare, primarily because I like working with people in the community and helping them to navigate this immense amount of information that comes with understanding Medicare and making sure that you get the benefits you deserve. So Manuel is so kind to conduct the meeting today, and take it away.
Let's start. Yep. So we'll start with our program. Next slide, please, would be Medicare 101. So navigating Medicare benefits. I know that Medicare can be a little bit confusing. It's almost like an alphabet soup, A, B, C, D, what letter we are supposed to sign up for. So we are going to see if we can go through the information so you can make the right choices for yourself concerning healthcare in Medicare. So next slide, please. So that will be for our Florida license. Our Hawaii license will be at the end of the program. Next slide, please. And that's Bernice and myself here, enjoying ourselves in the countryside, and as well as Kailua Kona, where we have lived for 22 years, and we go there periodically. We'll be going back actually in July to visit our friends and clients, and then as well for the annual enrollment period. So we basically have 2 homes or residences, one here and one in Hawaii. Next slide, please. So how to enroll in Medicare. Now, this is an important issue, and a lot of people need some information. If you are currently receiving Social Security, meaning Social Security cash benefits, then you are automatically enrolled in Medicare Part A and B. So they will send you the card in the mail and you are automatically enrolled. Now, these people that are currently receiving Social Security are people that sign up for Social Security cash benefits when they turn 62. In other words, they are early recipients of the cash benefits. And so if you enroll early in Social Security, then you're automatically enrolled in Medicare Part A and B when you turn 65 years old. So you got to be 65 in order to qualify for Medicare. Now, if you are still working, about to retire, or not receiving Social Security, then you need to sign up yourself. You can go on this website, ssa.gov/Medicare/sign up. You can sign up online, or you can contact the Social Security Administration over the phone. They have an 800 line. So now, if you are receiving Social Security early because of SSI, In other words, if you are disabled or you have Lou Gehrig's disease, then you can sign up for Medicare also before the age of 65. So you gotta be disabled for at least 24 months. So if you are disabled for 24 months, in other words, you have a letter from your doctor saying that you are disabled, then you would qualify for Medicare. In other words, you can get the benefits. And the same way, you would need to call the 800 number to sign up with Medicare. You need to call Social Security Administration. All right, next slide, please. So Social Security, if you're under 65, you may be eligible if you have permanent kidney failure or if you receive disability benefits. Supplemental Security Income, SSI, does not qualify you for Medicare on its own. Even if you receive SSI, you must meet one of the other requirements to qualify. As I say, you have to be on Social Security benefits or SSI for at least 24 months. Okay, next slide, please. So if you are 65 years or older, you can enroll online for parts A and B, or part A only. You don't have to enroll for both parts. You can just choose part A. You can delay part B if you are already covered through an employer group health plan. What happens is that people that have an employer health plan, they don't want to sign up for the part B because then there will be a monthly premium. So in order not to pay for the monthly premium of the part B, they basically sign up for the part A because the part A does not have a premium, basically it's a zero cost. And that, as we will explain later, covers your hospital benefits. So basically people would want to have that part A benefits because then they have like another insurance on top of their employer health plan. So the application is for retirement benefits and Medicare or Medicare only. So that's what the application is for. It's basically for your Medicare benefits only. Now, this is an important thing to mention is that once you retire from your employer and you no longer are employed or have a health plan through your employer, then if you're not covered through an employer-sponsored plan, then you need to sign up for Medicare within 60 days of retirement. Have had in the past issues with people that didn't understand this or was not explained to them, and then we had serious problems with this because if you pass that 60-day window to sign up for Medicare, then you are late for enrollment. So you may have to wait until the open enrollment period for Medicare, which is January 1st through March 31st. And then your effective date is not until July. So, you know, you may lose. I mean, I've seen people that they have lost some Medicare benefits. So 60 days really is the window after you retire from your employer. So next slide, please. Okay, sign up for Part B only. If you have previously declined or never signed up for Part B, you can sign up for Part B only. That means, you know, if you had Part A already, now you can call Medicare. Let's say you retire from your employer and you want to just go on retirement and you want that Medicare Part B, then you would call Social Security and sign up for Part B only. So next slide. Okay, so this is what the different parts cover. This is an important part. So Medicare Part A, most people pay no premium. What does that mean, most people pay no premium? Well, basically to qualify for Medicare Part A, no premium, these are your benefits that you paid for when you work for an employer for all your life, basically. But the minimum is 10 years or 40 quarters. So if you work for 10 years or 40 quarters, then in this country, the United States of America, then you are entitled to these benefits. You have paid through your payroll check for these benefits, Medicare insurance. So, so you qualify, and then you will have no premium on your Part A, which covers inpatient hospital care, skilled nursing care, hospice care, and home health care. So all of those benefits are included in the Part A. However, let's suppose that you immigrated to the United States and you only work for, let's say, 3 years or 4 years. So you will be missing some of the credits necessary in order to get a no premium Part A, and you may be required to pay a premium. Or I have seen that people have to work a few more years in order to qualify for the Medicare Part A no premium or Part B no premium. So you will have to really fulfill the requirements of the 10 years or 40 quarters in order to qualify for Medicare no premium. Otherwise, there will be a premium to it. Next slide, please. Okay, so Medicare Part B covers doctor services, physical occupational therapy, X-rays, MRIs, CT scans, durable medical equipment like wheelchairs or oxygen tanks or things that you may need, preventive services. Most people will pay a premium, and we'll go into that in a minute. So there is a premium for the Part B, and there is a 20% co-insurance. Okay, so if you, let's say, you go to see a doctor and you have original Medicare, so you go and you present your card, you will be required to pay 20% of your co-insurance. So let's suppose the bill is $200. So you will be required to pay $40. That will be your cost if you have original Medicare, because Medicare pays 80% of the cost, but the other 20% is your responsibility, basically. Let's see. Any questions there from anyone there? Darcy? Or if you have any questions, you can ask questions. Otherwise, we'll move on to the next slide.
Hey, I have a question. Can you use, if you don't have 10 years credit, can you use your spouse or ex-spouse time?
Yes, you can use your, actually, if let's say that you are a US citizen, but you are a homemaker and you were married to someone that was qualified according to Medicare rules, work in this country for 10 years or 40 quarters, then you would be covered as well. You don't have to have worked for 10 years as long as you were married to someone that, worked for the 10 years or 40 quarters. Now, if you live in this country and for some reason you are not connected to someone, you were not married legally, or you never married, or for whatever reason you are not connected to someone that qualifies for Medicare, then you wouldn't qualify for it. So if you didn't pay into the system, the system doesn't have any responsibility because you didn't pay into the insurance. This is actually insurance. You have been paying through your payroll, basically, all along, So if you didn't pay for it or your spouse didn't pay for it, then you don't qualify. But if you are married to someone that qualifies for Medicaid, yes, you would qualify as well.
And if you're divorced, how many years must you have been married before you're still eligible?
That's a tricky question. Usually the 10-year rule is the one that applies. So usually, I've read it a long time ago, but I believe that is the right answer, that you have to be married to someone for about 10 years. Now, let's suppose that if someone had married someone, then divorced, and married a second wife, that person would also qualify if they were married for another 10 years. So I think the basic number is 10 years. You have to be married with that person that qualifies for the Medicare for 10 years.
Okay, that's true for Social Security too, so I think you're right.
That's correct, yes. And that's what I read when I studied Social Security benefits as well. Okay, next slide, please. Okay, Medicare Part B. Now, when you sign up for Medicare Part A and or Part B, that doesn't include the Part D, okay? So a lot of people, this is a lot of confusion. And I wanted to make a point of this because a lot of people, they think that they have a Part D included in their Medicare plan, but they don't. So Medicare Part D, you do have to sign up separately from Part A and Part B. What is Part D? Part D is the benefits that cover prescription drug plans. Okay, prescription drugs. In order to purchase a prescription drug, either you pay cash for that prescription drug, or you need to have Medicare Part D, in other words, some kind of insurance to lower the cost of the medication. So it is very important that you sign up for Medicare Part B, and I'll tell you why in a minute. See, Medicare Part D, if you don't sign up the same way as Medicare Part A or Part B, you have to sign up within that window, which is 3 months before you turn 65, the month you turn 65, or 3 months after you turn 65. So it's basically a 7-month window. Unless you sign up within that window, the 7-month window, you would be considered late. And again, you may have to wait until the next open enrollment period, which is in January, and you may be assessed a penalty. So for Part D, is the same way. You need to sign up when you are eligible within that 7-month window. So if you don't sign up for the Part D, then you would have a late enrollment penalty. Now, late enrollment penalty is not very much, but it is going to be every month. You'll have to pay it for the rest of your life. So it's not very much. It's going to be like $3. It depends on inflation, and it depends if the Medicare Part D premiums go up or down. But on a general rule, I mean, I've been doing this for many years, it's somewhere around $3.40 a year. So let's suppose you don't sign up for 1 year. That means your penalty will be $3.40, more or less, $3.30 or $3.50, somewhere around that figure. Again, depends on the inflation. So $3.40 would be your penalty per year. Let's suppose you don't, and I've seen this, people don't sign up for that Part D for 10 years. So now that's $34 a month you got to pay in penalty. So, you know, if you let it go year after year, a lot of people think, well, I don't take any drugs now. Well, yeah, you don't take any drugs now, but what happens 10 years from now when you are 75, or 20 years later when you are 85 years old? What happens if you have to take certain drugs? And some of these drugs can be very expensive. You know, I've seen pills that are, you know, like $100 pills. So you have to be very careful with this Medicare Part D. So, and because enrollment is voluntary, right? As it says there, they're not going to sign you up. Nobody's going to force you to enroll for Part D. They're not going to send you a card. You're not going to be enrolled unless you enroll with, as point 1 says, contract between CMS and a private insurance company. You do need to get a Part D through a private insurance company that sells this Medicare Part D insurance. So, also, you can get it 2 ways: through a standalone plan, in other words, standalone Medicare Part D, or you can get it through a Medicare Advantage plan. So there are 2 ways you can get this Part D. Anyway, let's continue. Next slide. So if you need help with medications, you can apply for a low-income subsidy. A lot of Americans, they don't know this, but a lot of them, almost 50% of the seniors would qualify for low-income subsidy, because the low-income subsidy is a federal benefit that is not as stringent and as strict as the Medicaid benefit system. So a lot of people may qualify for low-income subsidy that don't qualify for Medicaid. So, you know, your best bet is just to try it. You don't have anything to lose. You can go to Social Security, SSA.gov. On the search field, you type extra help, and you go into the extra help link, and you fill out an application. They'll ask you questions concerning your income and your employment and your assets. And if you qualify, then they'll give it to you. The advantage is that then you will have a reduction on the cost of your medications. So it is advantageous, and it doesn't cost anything. You can just go on SSA.gov and apply for it. So here we have more or less the requirements, which is monthly income less than $1,823 for singles, and $2,465 for couples. Resources less than $15,500 for singles and $30,950 for couples. What they mean by resources is cash that you have in the bank, and that may include also IRA monies or retirement funds like a 401k plan. However, if you meet the thresholds and you are qualified, then the plan will help with the deductibles, copays, and co-premiums. So it's very advantageous. Amounts are based on yearly income, and they may change on 2024. So, all these premiums, and even for Part B, they change on a yearly basis. Like last year in 2022, we were paying $170 a month for Part B, but this year in 2023, we're only paying $164. Actually, it went down. So it depends on certain laws or laws passed by Congress, or maybe certain benefits that Congress passes, or that the president is canvassing for, or whatever, to give certain benefits to the seniors. So that those premiums may be going up and down also because of inflation or so many of the different circumstances. So every year you really need to check with either the internet or your agent or someone that tells you what your premium will be. And usually Social Security is very good at this, and they will send you a letter telling you if the Medicare costs have increased or decreased. All right, next slide, please. Okay, so here we have a list of these the Part B monthly premiums. I hope you can read this. It's a little bit fussy here on my computer, but basically, it's kind of a little, I'm sorry, it's a little bit blurry. There you go. That's a little better. So if you file if you file single, $97,000 or less, or you file joint $194,000 or less, or your premium will be about $164. That's what it is today. Now, if you make more than $97,000 single, or $194,000 for a couple, then it will go up to $230 and so on. So there is an increase in the premium based on your income. Any question concerning these slides? Sometimes this can be a little confusing. And also goes for Part D monthly premiums. There is an increase on the monthly premium. There are, concerning the Part D monthly premiums is based on what kind of plan you get and what you need. Some plans may be more costly, but they include drugs that you may need because they're prescribed by your doctor. And so in order to get those drugs, you may have to sign up for a plan that may be more costly than others. So that's where you have to look at the formularies and see what the different plans are offering. Okay, next slide, please. Okay, so here we go. This is a very important slide, and this is the two main Medicare coverage choices, okay? So we have on the left, you have the original Medicare, and with original Medicare, you will have Part A and Part B, as we discussed, hospital insurance, and Part B, medical insurance. Now, if you want to go that route, the original Medicare route, then you will need a prescription drug coverage, or Part D, as we discussed earlier. And then if you want to cover the 20% that Medicare doesn't cover, then you will need to get a Medicare Supplemental Insurance Policy, or Medigap, okay? So the Medigap policies, they come in different letters like G or F or K or M. So there are different policies that have different benefits, and it can get confusing. At this point, you may probably have a separate appointment with an agent, or talk with someone, or go on the internet and get more information concerning the benefits that these policies have. But basically, Medigap policies, they have a premium, a monthly premium. They are more like permanent type of insurance. So as long as you make that monthly premium, you will have that insurance throughout your life. But you got to make that monthly premium. That's part of the insurance business, or the way insurance works. You do have to pay for that monthly premium in order to have insurance. The same thing happened with the Part B. The Part B that you pay to CMS, to the Centers for Medicare Services, or Medicare, you do have to make that monthly premium. I just had a friend that called me with a problem because he was out of the country for several months. He went traveling to Asia, went to Thailand and Japan, had a great time. But at the same time, he didn't make arrangement to pay for that Part B. So guess what? When he came back, he found a letter from Social Security saying, well, we are terminating your benefits for Part B because you didn't make the premiums. And so he called them back right away and said, no, I want my Part B reinstated. He said, well, now you have to wait to apply again in January during the open enrollment period. So he's trying to convince them that because he was out of the country, there was different reasons why he couldn't sign up and so on. So it can create difficulties for you. So make sure you pay that monthly premium. And if you go out of the country, let's say you go out for several months because you're going to, I don't know, go to Thailand or Japan or some other country, you want to visit those countries and see their natural beautiful nature, or museums or temples or whatever, make sure that either you pay for that Part B through an automatic, like an automatic deposit, or pay Medicare through your Social Security benefit. Okay, so they can take the Medicare premium out of the Social Security benefit. Make sure that it's paid somehow on a monthly basis. Otherwise, your policy will be terminated. And that's what it is. If you don't pay the premiums, they won't be able to keep up with your Medicare Part B. And you can get reinstated, but it is difficult, and you may be without insurance for a few months. So you have to make sure that you follow the rules. The same thing would be for the Part D, or the same thing will be for the Medicare supplemental plans. You got to make sure you pay those monthly premiums. Probably the easiest way is by direct deposit from your bank. Medigap, you cannot pay from Social Security benefits. You'll have to pay from an ETF from your bank. In other words, a direct transfer. So that's one way to go, original Medicare, or you have the other option, which is Medicare Advantage plan, like an HMO or a PPO. Okay, that's what is called Part C. So the Part C, as the slide says here, it combines Part A, Part B, and Part D. Okay, and the drug plan. So most of the Medicare Advantage plans, they do have A, B, and D, and they are called Part C. Now, it can get very complicated. So for individual questions, you may want to call back later. But just to make it simple for you, you have basically two different choices. You can go the original Medicare, but in order to cover that 20%, you need to get a Medigap plan, plus you need to get the Part D plan. Or if you go the other route, which is the Medicare Advantage plan, that's probably the simpler route, except that those plans, Medicare Advantage plans or Part C, is much simpler to go that route, except that they change year to year. They can change. Sometimes they don't. Sometimes the benefits will stay the same for 3 years, 5 years. We have had plans that they stay for 5 years or 10 years the same, and the benefits don't change, maybe slightly here and there on certain benefits. But as a general rule, every year, those plans, they need to send their information to CMS, and those plans are advertised usually through Medicare and You, which is a book that you will receive when you sign up for Medicare. CMS will send you that book, Medicare and You, and then they list all the different plans in your county. So if you're in the county of Hawaii or the county of Alachua or any county, the county of St. John's or any county, the plans that are available in that county will be listed in that Medicare and You book that you will get in your mail. So very important that you think about this, what is best in your situation. Everybody's different. Everybody's not, one mold doesn't fit everyone. You may have a history in your family of heart issues or cancer. Maybe you need more insurance or more benefits than others. So you will have to see what is best for you. Okay. Next slide, please. Okay, so here we go. This is the alphabet soup of the Medicare policies. As we said, that's the option number one if you have original Medicare. And so if you opted for that Medicare option, then you got to see which plans are available in your county or in your state, like the state of Florida or the state of Hawaii. Most plans, the main plans that are covered in most states are going to be the A, B, C, G, N as in Nancy, and some counties may have K. The plan F has been phased out now. Only if you turn 65 before 2020, you can still sign up for plan F. But if you turn 65 after 2020, then you are not longer eligible for plan F. Now, plan F was considered at the time top of the line because they would cover 100% your co-insurance for Part A and Part B. So it was very advantageous, but the premiums were higher than the other plans. Now, Plan G is probably the next one next to the Plan F, because as you can see, they cover 100% of the Medicare Part A. They cover 100% of the Part B co-insurance. So this is the co-insurance that they pay is 100%, right? So if you look at under the column Plan G, it will show you that they cover 100% for blood, first 3 pints, 100% Part A hospice care, skilled nursing, Part A deductible, Part B deductible. Oh, I'm sorry. Part B deductible is not covered by the Plan G. It was only covered by Plan F, but that's why Congress passed that law that says, well, now one can get the Part F. They said, well, people have to put a little bit of money for that Part B deductible, which is around $200. I think this year is $203. One-time yearly deductible. That's all. After that, of course, the plan will kick in at the 100%. And the other thing that they cover will be foreign travel at 80%. So let's say you have an emergency and you are traveling outside of the country. You go to Europe, to France, or you go to Spain, and you have an accident or you have an emergency, you go to a hospital, then there will be a foreign travel emergency benefit of up to 80% of the cost. So those plans can be very advantageous. The Plan G covers most of the cost. The Plan N also is very advantageous. The only thing that I would suggest with the Plan N, again, you would have to look and read carefully the materials before you decide for a plan. You have to be very attentive to this and see. They may look like the same, but there are certain costs that may not be covered. Usually the Plan N, one of the issues with the Plan N that I have seen in my experience as an agent is that they don't cover the excess charges. So people say, what is excess charges? And I thought that too, when someone brought me this case a few years ago, so why do I have this bill from this hospital visit? And then I have to study it and analyze it. Then I'll figure out, oh, these are for Part B excess charges, which means that they do an operation in a hospital. There is certain charges related to doctor or drugs or prescription drugs that they gave you at that time. There are excess charges that are not covered by Medicare, and then you'll be responsible for that. Usually the Plan N will not cover those excess charges. The Plan G would cover the excess charges, but again, the Plan N is lower premium as a rule than the G plan. So be careful. Again, you have to weigh, how much money can you pay in premiums, and do you need this plan or not? You have to really think carefully, meditate on what would be the most convenient plan for you. Everybody's different. Not everybody has the same options. So you have to take a look at it carefully. All right, next slide. Medicare Part C, Medicare Advantage, that's a contract between private insurance companies and CMS. Medicare Part C must be as good as original Medicare, so they got to offer at least as much as original Medicare is offering. May include additional benefits not covered by original Medicare, especially nowadays in many different counties. They include different benefits like dental or vision or hearing, even acupuncture, like some of the new acupuncture or chiropractic treatments. They are included in some of the plans. In other words, there are extra benefits, additional benefits that Medicare doesn't cover. And also the Medicare Part C, they have a Part D or prescription drug included in the Part C, so it's very advantageous. Now, there are Medicare Advantage plans that don't have a Part D included, and that is because some people don't want that Part D, especially people that are like veterans. Veterans, they receive benefits from the VA or Veterans Administration, and they don't need a prescription drug plan in their plan because they already have the prescription drugs coming from their VA benefits. So they may get what is called like an honor plan or a legacy plan or some kind of plan that doesn't have drugs because there may be a reduction on the premium cost, on a reduction on the Part B cost. So they are, in a sense, cheaper, but they don't have a Part D premium. Remember, if you are not going to have a Part D premium, it's because you have prescription drugs benefits from either your employer or the VA benefits or some other way. So as a rule, try to sign up for the Part D as soon as you can, as soon as you are eligible with your original Medicare. But if you have a Part D or prescription drugs from some other source, like the VA, then you may not need that prescription drug plan because you already have prescription drugs from another source. Another good thing about the Medicare Advantage plans is that they have a maximum out-of-pocket limit. Now, that's important because original Medicare does not have a maximum out-of-pocket. Now, you can say, well, what is that? Well, that is your maximum liability. That's your liability. It's like, how much do you want to, to spend if you go to a hospital? Well, it depends. If you go to a hospital, you have an accident, you have an emergency, you got to go to a hospital 3 times in a year or 4 times in a year. Well, what is your maximum liability? If you have original Medicare, that liability is 20% of that cost. It could be huge. It could be, I've seen very expensive bills. So usually the Medicare Advantage plans, they will have a limit on that out-of-pocket limit, which could be between $3,300 and $10,000. It depends on the plan that you choose, but there are different, there is a gradation of the maximum out-of-pocket limit, but at least you know what is your maximum liability. So it is a good thing. Now, if you had a Medigap plan, like we discussed earlier, the G plan, the N plans, K plans, they also have a maximum out-of-pocket limit. In fact, there is no, in a sense, maximum out-of-pocket limit with a G plan because they cover everything again. All right, next slide, please. Dual special needs plans are for people that have Medicare, and they also have state assistance called Medicaid. And those are very beneficial plans, but again, is based on your income. It's for low income people, and they have to be qualified through the state program, through like the state of Florida or the state of Hawaii or any other state where you reside. A lot of the dual special needs plans, they're very advantageous because they'll include routine acupuncture, routine chiropractic, comprehensive dental, eyeglasses, gym membership, hearing aids, healthy foods, transportation, over-the-counter items, and many more benefits for 2023. So I guess the advantage there is that you have a combination of the federal Medicare benefits and the state benefits from Medicaid. Okay, any questions at this point? You have, sorry, I'm maybe going a little fast. It's kind of a little bit dense material, but if you have any questions, please let me know.
Question, how do we find out what plans are in our county and who offers them so that we can compare the various costs? Right.
Okay, so the plans change year after year. So for 2024, we don't know yet because that information hasn't come out yet from CMS. For 2023, the information you can get will be through my Medicare.gov or Medicare.gov. That will have a lot of the information. Also, when you sign up at age of 65 with Medicare, they will send you a book called Medicare and You that comes directly from CMS. And in that book, it will have all the different benefits that is offered through CMS and the Medicare benefits, as well as all the plans in that zip code or county where you sign up for.
And then it's just up to finding out what each company charges for these various plans?
Well, as we discussed, then you have to, first of all, choose which plan you want to go with, either Medigap, right? Original Medicare and Medigap, or Medicare Advantage plan. Yes, you will have to find out what the different companies offer. This is a common practice that you should talk with an agent or someone that is a professional that knows these plans, because really this is like a labyrinth. There is so many plans, so many premiums, so many benefits out there, and everybody's different. So you really need to speak with someone that is a professional that knows the benefits, that knows the plans in that particular county, and try to find the best for your situation. That's the way it works. Sometimes people may get phone calls from people, outsiders from somewhere, that they are trying to give you information, but really your best bet is to talk with a local agent or find information yourself on Medicare.gov or through reading that book, Medicare and You, that is on that CMS will send you. Is that all right? Is that a good answer?
Yes, thank you.
Okay, next slide, please. Okay, so as we discussed earlier, we'll go through this quickly because we discussed this. The Medicare Advantage only, no drugs. That would be for people that may have VA or TRICARE. TRICARE is another government program for people that were employed by the government, and they'll have the TRICARE. Actually, my mother-in-law, for instance, had TRICARE. And I have, over the years, I've encountered people that have TRICARE. Now, if you have VA or TRICARE, you can still sign up for Medicare and have the Part A, Part B. You may even be able to sign up. In fact, I have signed up people, Medicare Advantage plans that have VA or TRICARE. You just have to know some of the rules concerning VA or TRICARE. But you could sign up for any one of those benefits as long as you meet the requirements. You have worked in this country for 10 years or 40 quarters, you're 65 years old, or you are disabled after 24 months. If you qualify according to the rules, then you can sign up for any of these benefits. Of course, if you have VA and Medicare, that's probably very good. I mean, we can have both kinds of benefits. Among other things, because VA has excellent benefits concerning their drugs, and sometimes they have very good hospitals, especially in Hawaii. In Honolulu, there is a very good hospital there. Also here in Florida, in Gainesville, there is a very good hospital as well for the VA. So, sometimes people, especially people that are in the armed forces and they have served our country for so many years, they want to have very good insurance, and, they like to have a double insurance, and that will probably help them as well. This is the additional benefits with money back in Social Security checks. That means that they'll give you some money back from the Part B. So it's advantageous for those people that don't need the drug plan. If you need the drug plan, this is not for you. But if you don't need the drug plan, then it will be advantageous not to have drugs in your Medicare Advantage plan, because then you have additional benefits with money back in Social Security checks. And instead of paying $164, you may be paying $124. Or, it depends on the plan. You may even pay less. You may pay $90 a month instead of $164. Some of these plans also have comprehensive dental, gym membership, hearing aids, routine chiropractic, routine acupuncture, and post-hospital meals. In other words, they'll send you meals if you have gone to a hospital. And then after you come back to your home, you don't feel like going to the store, buying groceries and cooking meals. So some of these plans will send you hospital meals by mail or UPS or something. Next slide, please. Okay, so Medicare Advantage plans with prescription drugs. There are two main varieties: HMO and PPO. I wanted to keep this very simple, otherwise it gets really complicated. I know that your head must be spinning by now. It took me many years for me to figure these things out, and I suppose that if you get a program like this all the time, whoa, it's like how many plans can I learn here, right? But Medicare Advantage, basically, there are two kinds. One is the HMO and the other is the PPO. What plan should you get in case that you get a Medicare Advantage? Remember, the other kind is original Medicare and Medigap or supplemental plans. But if you want to go the route of the Medicare Advantage plan, because usually Medicare Advantage plans are cheaper or they have lower premiums than the Medigap plans. So if you want to go this route, then you got to realize that there are two different plans. There is the HMO and PPO, Health Maintenance Organization or Preferred Provider Organizations. The HMO, as a rule, they have zero to low premium plans, so they are very inexpensive. And they have additional benefits beyond original Medicare. Many participate with insulin savings programs, especially for people that have diabetes, of course. Then they have dental, vision, hearing, gym, acupuncture, chiropractic meals, etc. So HMO plans can be very advantageous, but the caveat is that for an HMO plan to work well for you, they only work in the county where you reside, and the doctor, the hospital, or the providers that provide these benefits must be in network with the company that is offering the HMO plan. So if the doctor is not in network with the company, then it's not going to work for you. They won't even treat you. They won't even accept your payment. So you're going to be stuck. You're going to be limited to only the in-network doctors. Now, if you are in a city, in a county where a certain company has been there for many years and they're well established and a lot of doctors take that plan, well, maybe you can stay with that company, with that HMO plan, because obviously they have more benefits, richer benefits, so to speak. They'll give you maybe higher dental benefits or vision benefits or hearing benefits. They'll give you more. You can get more out of an HMO, but then you are kind of restricted to who you want to see, which doctors are going to take care of you, or the hospitals, or different things. With a PPO plan, the difference is that, first of all, you use in-network doctors and out-of-network. So now you can go to all doctors that take Medicare. They may not be in the plan that you are in, but you can see doctors outside of the plan, out of network. Now, there will always be a co-insurance or copay, small copay or co-insurance, but at least you will be able to see someone. And in that case, for instance, if you reside in the county of Hawaii and you want to travel to Florida, and you're visiting Florida, you go to Disneyland, Orlando, and it so happened that you're visiting a friend and you're going to be there for a couple of months, and all of a sudden you need to see a doctor or you need to see a dentist or some specialist. Then if you have a PPO plan, you would be able to use your PPO plan. You can go to see a doctor. You will pay a co-insurance, but at least you'll have access to a doctor. If you have the HMO plan, I just had actually a case like this of a person that came to us asking for help because they have an HMO plan, but they are out of the network. They're in another state. And they said, what do I do now? I said, well, either you go back. I mean, she was treated as an emergency. As an emergency, you can use your HMO plan. But if it's not an emergency, the doctors, they'll require that you give them cash. And if you don't have the cash, they'll say, well, we treated you as an emergency, we stabilized you. Now you got to go back where this plan comes from or where you are from. So you would have to go back. You're in Disneyland, enjoying there in Orlando, but then all of a sudden you had this issue and it's no longer, it may be or not an emergency, but they took care of you, they stabilized you. Now you got to continue with certain procedures, and then you will have to go back to Hawaii because in order to get care, the only way you can get care at the prices that you can afford, maybe through that HMO plan, which is only in that county. You see, that is the issue. But if you had the PPO plan, now you can be in Orlando, Florida, say, okay, I need to go and see a doctor. It will just cost me another $50 or $80, but you don't have to go back all the way to Hawaii in order to see a doctor or a specialist. So that is the advantage of a PPO. The other advantage is that you don't really need a referral. See, with the HMO plan, if you need to see a specialist, you need to have a referral from your PCP, your primary care physician. But if you have a PPO plan, you don't need a referral. You can actually make an appointment to see a specialist. If you have to see a heart specialist, a cardiologist, or rheumatologist, or any other specialist, you can make an appointment with that PPO plan, especially if the cardiologist or a specialist is in network with the provider. Okay, so thank you. And let's see, next slide, please. Okay, so here we are. And this is where you will probably have to make a choice. Where do you go from here? You can go Advantage plans, Supplemental, or employer group health plans. That means that if you're still employed, you might want to choose the employer group health plan because maybe the benefits are good and your premiums are low. Sometimes employer group plans, they have certain arrangements with the Medicare, original Medicare, and you may be able to go that way. But for most people, they're going to go either the supplemental Medicare gap plan or the Medicare Advantage plan. That's where you have to make that decision. All right, next slide, please. Okay, so here you are going to have to compare supplemental plans versus Medicare Advantage plans. It's a little bit fussy. Maybe we can get it a little bit clearer picture. Basically, Advantage plans will have lower premium. The supplemental plans, one of the issues with supplemental plans is that if your issue is not guaranteed, you'll have to go through underwriting. That means that you need to apply for that supplemental plan within 6 months of turning 65. That's your initial enrollment period for supplemental plans. Advantage plans is 3 months, but for supplemental plans is 6 months. After that, you need to go through underwriting. However, there is no underwriting for Medicare Advantage plans. You can always sign up for them during the annual enrollment period or during the enrollment periods for Advantage plans. But with supplemental plans, they are very restrictive there, and you will have to go through underwriting. So that means that if you have any kind of health issues, you may not be able to sign up for a supplemental plan after 6 months. Otherwise, your application is guaranteed. In other words, your acceptance is guaranteed if you file within the initial enrollment period. With the supplemental plans, you don't really need a primary care provider. You can go to any providers that take Medicare. So if they take Medicare, they'll take your supplemental plan. So they are very wide. So it's very widely accepted throughout the United States and even outside of the country by different doctors. But with the Advantage plan, you do have to sign up for a primary care provider. So you got to develop a relationship with a doctor that can take your plan. With supplemental plans, you can enroll at any time, except that, again, you may have to go through underwriting, but you don't have to enroll it specifically during the annual enrollment period from October 15th through December 7th. You can enroll anytime, but then you may have to go through underwriting if you are not in your initial enrollment period. Another thing is that they are portable, so you can take it to any state in the country or outside of the country. You can travel in the US with it. The Advantage plans, sometimes you can. If you have a PPO plan, you can travel in the US with them. Again, some of the companies may have in-network in other states, so it is advantageous if you see a doctor that is within the network of that company. Now, concerning dental, vision, drugs, and maximum out-of-pocket, the Advantage plans, they have that, while the supplemental plans don't. They don't have a dental benefit plan or vision benefit plans. They don't include drugs, and they don't have a maximum out-of-pocket. Although the Plan K, I believe, has a maximum out-of-pocket, but the G plan wouldn't because they cover up to that 100%. So those are considerations when you choose which route to go, supplemental versus Advantage plans. You got to see, well, remember, one of the main things is that the supplemental plans, they have a premium, and it's going to be higher than Advantage plans, right? Advantage plans, they have low premiums. Supplemental plans will be more costly. Supplemental plans don't have networks, so you can go and see any doctor out there that takes Medicare, while Advantage plans, they have networks that would be restrictive because you got to go specifically to that network, while supplemental plans, you can go anywhere with it. You can take it wherever you want. Any questions here? This is a very touchy slide here, so if you have any questions, let me know. Okay, if not, we will go to the next slide. I think we're pretty much almost at the end here. Okay, so the key enrollment periods you need to remember is the initial enrollment period. Enroll anytime during the 7 months around your 65th birthday. We discussed that earlier. So figure out the month of your birthday, then you have 3 months before your birthday, the birthday month, and then 3 months after your birthday. If you don't sign up within those 3 months, then you will be late to sign up, and then there may be a penalty on that Part B. And then you'll have to wait until you are able to sign up during the open enrollment period for Medicare, which usually is in January. The annual enrollment period is October 15th through December 7th. That means that you can change plans, you can drop plans, you can do different things. And it's from October 15th through December 7th. When you sign up for or you change plans, then your new plan will be effective date January 1st. So those are the two main dates or periods you need to remember. The initial enrollment period when you turn 65, and the annual enrollment period, which is the time when you can change your plan or enroll for a Medicare Advantage plan. Let's say you have original Medicare and a prescription drug plan, but now you want to get a Medicare Advantage plan, so that would be the time when you would be able to get one. October 15th through December 7th. Okay, next slide, please. Now, there are special enrollment periods: retiring, moving to another country, Medicaid, low-income subsidy. So that that's a lot of information there, and you may not be able to get it. But let's say that you move to another state, or you are retiring. You will have 60 days to change your plan, or to enroll in a new plan. You do have 60 days. So if you move from, let's say, from Hawaii to California, from Florida to Georgia, you have 60 days to change a plan within the county where you are going to be residing. If you have Medicaid, then there are different special enrollment periods there. Usually once a quarter, you can change plans. And if you receive low-income subsidy, as we discussed, which is a subsidy from the federal government, you can also change, like in Medicaid, once a quarter. The Medicare Advantage open enrollment is January 1st through March 31st, meaning that you can also change plans during this period, but you cannot go from original Medicare to Medicare Advantage during this period. You can only change between Medicare Advantage plan, not from original Medicare to Medicare Advantage. Only if you have a Medicare Advantage plan that you can change during this period, January 1st through March 31st. All right, please, next slide. Okay, so we reached the end of our conversation, of our seminar here. That is our card, business card with our phone numbers and so on, Bernice and myself. And so if you need any further help, you can give us a call and we can discuss different issues that you may have or questions. We play music. Bernice plays the harp. There is in Kona. We took some beautiful photos that were published in the Hawaii Airlines magazine. Hawaiian Airlines, they produce an article on us, and we took some photos. That's a very beautiful photo of us, actually. Really enjoyed it. Great photographer. Okay.
And you both are exceptional musicians, just lovely.
Thank you. Thank you very much. So here we have other resources you have, ourselves, as well as these two other agents here in Florida. They have Florida license. So if you watch this program later on, I know there is some people that were working during this time and they couldn't come to our meeting, and they are requesting that we send them recordings. So if you live in Florida, you can go to any of these agents that will be able to help you further. So they are licensed here in Florida as well as we are, and they can help you with your needs. All right. Well, thank you very much. Thank you very much, SouthCare, for inviting us to do this program presentation. Thank you for hosting it. And if you have any questions, give us a call. Thank you so much.